Hello, my dear students. Let's begin our class. We have studied some antibiotics. This class, we will study synthetic antimicrobial agents. This drug a little different from antibiotics. Antibiotics means the drugs come from bacteria, and this drug means we use artificial method synthesize the antimicrobial agents. Quinolones. The first kind of synthetic antibiotics, we will study quinolones. Quinolones divide into three generations. The first generation quinolones, such as nalidixic acid. This drug isn't used in clinic. This drug can kill gram-negative bacteria that cause urinary tract infections, and its intrinsic activity is limited, so we don't need to remember the drugs, and it wasn't used in clinic. The second generation quinolones, such as norfloxacin, ciprofloxacin, and ofloxacin. In them, ciprofloxacin is the prototypical agent in quinolones, and it is the most widely used agent in clinic, ciprofloxacin. Ciprofloxacin, compared to the first generation quinolones, broader spectrum and more powerful, more potent than the first generation. And this year, the newest quinolones, they are the third generation quinolones, such as sparfloxacin. Sparfloxacin, broader spectrum than the second generation, especially gram-positive bacteria and anaerobic microorganisms, more potent than other quinolones, and also can kill chlamydia, mycoplasma, legionella, mycobacterium, and so on. So, quinolones. Let's study the drugs. The prototypical agent is this one, ciprofloxacin. Chinese name is 环丙沙星. The mechanism of action, quinolones exert their bactericidal effect by inhibiting type 2 topoisomerase and also inhibit topoisomerase 4 and then inhibit bacterial DNA synthesis. Inhibition of DNA garase prevents the relaxation positively superclide DNA that is required for normal replication. So, we studied the total mechanisms in the beginning of antibiotics, and we have studied quinolones inhibited bacterial DNA synthesis. Okay, so let's study the common pharmacological properties of quinolones. Quinolones, these drugs have a wide spectrum of activity. They are active against a variety of gram-positive and gram-negative bacteria. And cross-resistance cannot occur between quinolones and other antibiotics. So this is very important. Cross-resistance cannot occur between quinolones. So that means if the patients use ofloxacin ineffective, they can change into ciprofloxacin. If ciprofloxacin no use, we can change into sparfloxacin or change into other antibiotics, no cross resistance. And then after oral administration quinolones, they are well absorbed and they also have longer half-life. For this reason, so quinolones can be widely used in clinic because oral administration intravenous using, and longer half-life. So very easy to use, more convenience than any other drugs. And the adverse actions are lower than other antibiotics. So for this reason, in fact, the pharmacological effects, only one word can explain quinolones adverse action: broadly, widely, wide spectrum, broad spectrum, broad spectrum, wide spectrum. So means that can use to treat a lot of bacterial infection. Okay, so clinical using very easy, broadly. Quinolones are used for treating respiratory infection, urinary tract infections, prostatitis, gonorrhea, and the infections of soft tissues, bone tissues infection, and joint infection, and so on. So, quinolones, it is the artificial synthetic bacterial agents. And this drug, very easy, mean pharmacological effects, broad spectrum, and clinical using, broadly can be widely used in clinic to treat its kind of infections. We can use quinolones because broad spectrum. Quinolones, such as this one, norfloxacin. Norfloxacin in the second generation is mainly used for treatment of urinary and intestinal tract infections. Each Chinese know this drug because we call this drug is 诺氟沙星, and this drug mainly used in clinic to treat intestinal tract infections. So, in fact, each Chinese use norfloxacin to treat diarrhea. Yes. So each Chinese they go to another place or go to another city, country, and they prepare the drugs to prevent diarrhea. And they take the drug is this one, norfloxacin, used to treatment of bacterial diarrhea. In quinolones, the most widely used is this one, ciprofloxacin. Chinese name is 环丙沙星. Ciprofloxacin 环丙沙星, it is the most active of the quinolones. In the second generation, it is the most active. It is active against both aminoglycoside resistance and cephalosporin resistance, gram-positive and gram-negative organisms. Let's explain ciprofloxacin. It is the most widely used antibiotics, antimicrobial agents in quinolones. It can kill. So let's explain ciprofloxacin. The first word is broad spectrum. Broad spectrum, so can kill. The second word is bactericidal agents. Can kill lots of bacteria. So in clinic, can use to treat lots kind of infections, disease, respiratory infection, gastrointestinal tract infections, or tissue, organ, and so on infections. We can use ciprofloxacin. Ciprofloxacin, even the patients use aminoglycosides or use cephalosporins have drug resistance, no problem. We can turn into ciprofloxacin. Okay, so ciprofloxacin is active against both aminoglycosides resistance and cephalosporins resistance. Also can use ciprofloxacin, so very useful. And lower adverse action, mild adverse action, higher, longer half-life. So the patients use ciprofloxacin one day, one time. They can oral administration the tablets or ciprofloxacin capsular or intravenous using and intramuscular injection. So this drug can be absorbed easily. Next one is ofloxacin and levofloxacin. These drugs can inhibit gram-positive and gram-negative, kill gram-positive and gram-negative bacteria. Same with ciprofloxacin. This one, levofloxacin, oral administration, have an advantage. Nearly 100% bioavailability, nearly to 100%. So can be absorbed totally, can kill bacteria. So very useful in clinic. We also use this one, levofloxacin. And then lomifloxacin, lomifloxacin. It is similar to norfloxacin in spectrum of activity, so broadly spectrum, widely used in clinic, lower idle section of these drugs. The idle section of quinolones are generally well tolerated. Gastrointestinal distress is the most commonly side effect, and most patients use quinolones. Its idle section mild, maybe mild nausea, upset, or vomiting. And the next one is the major idle section. The major idle section of quinolones is this one. Ankle Achilles tendonitis. This is the major idle section of quinolones. So in clinic, when you you study pharmacy or medicine, you should know quinolones. You should know less than 18 years old teenagers, children as the contraindication. The second one, elderly patients. Elderly patients more than 70 years old, we shouldn't give quinolones because this idle section. And the third one, some special patients. For example, spotters, we couldn't give quinolones because induce ankle Achilles tendonitis. So don't forget this, children as the contraindication. Less than 18 years old, we couldn't use quinolones. Next idle section is the phototoxicity, especially the third generation quinolones, such as lomifloxacin, such as sparfloxacin. They are the third generation quinolones, have this phototoxicity. Do you know phototoxicity? Means one kind of allergic reaction. This allergic reaction is the sunshine skin rash. Sunshine skin rash. It is one kind of allergic reaction. Only occurs the sunshine skin, such as the arms, the face, have skin rash. The last idle section is only the third generation quinolones have this idle section, cardiac arrhythmias. Sparfloxacin can prolong QT interval, so maybe induce bradycardia. For this reason, elderly patients, maybe you should pay attention to the elderly patients. Okay, so the idle sections of quinolones, just now we said, less and mild than other antibiotics. The major idle section is this one. Okay, so in quinolones, just now we studied the drugs. Quinolones are widely used in clinic, though we explained very fast, very easy. But this drug are widely used in clinic because this drug very easy. Pharmacological effects broadly, and clinical using broadly. Idle section is this one. Okay, next one. The second artificial synthetic antimicrobial agents is sulfonamides. In fact, sulfonamides is the oldest artificial synthetic antibacterial agents. And this year rarely used, so that's now we don't study this drug at first. Okay, so sulfonamides. Introduction of sulfonamides. The sulfonamide drugs were the first effective chemotherapeutic agents to be employed systemically for the prevention and the cure of bacterial infections in human beings in 1950, especially in 1970. The advent of penicillin and other antibiotics, such as cephalosporins, such as quinolones, has diminished sulfonamide useness, and sulfonamides are less frequently prescribed for a time. So past 20 to 30 years, we rarely use sulfonamides. And later, I will explain the drug's clinical using. Less frequently prescribed for a time. But this year in China, we still use sulfonamides. Later, I will explain. The introduction in the middle 1970s of the combination of TMP, trimethoprim, has resulted in increased use of sulfonamides for the treatment of specific microbial infections. So, clinical using of sulfonamide, some special infections, and through the combination with TMP combination with trimethoprim. The mechanism later we explain. Antimicrobial spectrum pharmacological effects of sulfonamides. Two words. The first word, bacteriostatic, inhibit arrest growth. The second word, broad spectrum agents, can inhibit gram-positive, gram-negative, and can inhibit some special bacteria. The features, the pharmacological properties of sulfonamides. The first one, antimicrobial spectrum, is broadly spectrum. The second one, cross resistance can occur among sulfonamides. So we explained this word several times. In sulfonamides, SD and SMJ can diffuse into cerebrospinal fluid. What's the meaning this sentence? This drug, though rarely used in clinic, SD and SMJ can diffuse into cerebrospinal fluid, so we also use them to treat meningitis, yes, as the first choice agent. And excretion is chiefly via the urine. In the urine, so the urinary solubility of the various sulfonamides varies widely. SD and SMJ can form the crystal in urine. For this reason, because damage the renal function and from the crystal urine. So, for this reason, rarely used in clinic because renal function damage. And so for this reason, sodium bicarbonate should be administered to prevent crystalluria. So the major adult section is crystalluria. Next one, the mechanism of sulfonamides. So we have studied the folic acid synthesis process in your biochemistry subjects class. And PABA under this enzyme tyrate synthesis and synthesis the hydrofolic acid, and then under this enzyme, the hydrofolate reductase and be reduced to folic acid, and then promote DNA or RNA synthesis. During this period, we know two enzymes very important. Sulforamide can inhibit synthesis and then inhibit folic acid synthesis. And TMP can inhibit reductase, so it also inhibit folic acid synthesis. For this reason, both of them inhibit folic acid synthesis. So in clinic, we should know we use sulfonamides and we should use sulfonamides co-administered with TMP, and the effects can enlarge shortened times. So for this reason, one inhibit synthesis, the other one inhibit reductase. Both of them inhibit folic acid synthesis. So in clinic, they should co-administered. Okay. Except SD and SMJ, this drug intravenous using, and we also have oral administration agents, sulfonamides, such as sulfasalazine. Sulfasalazine is used in ulcerative colitis. This one, you should know this, because the patients, some patients chronic diarrhea, 1 month, 2 months, and then you should use the intestinal scope. You can find diagnosis patients that are ulcerative colitis, chronic diarrhea patients. And this drug, sulfasalazine, still as the first choice agent to treat ulcerative colitis. Topical using sulfonamides, such as this one, sulfadiazine silver, is used topically to prevent infections of burn wounds. So some burn wounds, local administration gel, they are this one, sulfonamides. And this one, sulfamylone, is not interfered by POS and is used for treating infections of burn wounds. So burn wounds, lots of topical agents, they are sulfonamides. And the next one is the sulfacetamide assay. Is used for treating topical eyes infection. The last antibacterial agents, Mitronidazole, very useful. In anaerobic bacteria and sensitive protozoes, we use Mitronidazole. We studied lots of antibiotics, but most of them, they only inhibit or kill aerobic bacteria. But in some pelvic cavity infection or oral cavity infection or abdominal cavity infection, most of them, they infect anaerobic bacteria. And this anaerobic bacterial infection, we can use Mitronidazole. And have you listened carefully? I said this anaerobic bacterial infection always induce cavity infection, pelvic cavity infection, and abdominal cavity infection, oral cavity infection. Infect anaerobic and aerobic bacteria. We can use Mitronidazole. Mitronidazole is converted into an active form by reduction of its nitro group, and the active form bonds to DNA and prevents nucleic acid formation. So the mechanism of nitronidazole is inhibit bacterial protozoal DNA synthesis. And metronidazole effectively treats anaerobic bacterial infections. Just now I explained pelvic bacterial infection and cavity. Okay, and for example, just now I explained the pelvic infection, cavity or oral cavity infection. So, lots of patients use metronidazole to treat toothache because in oral cavity always infect anaerobic bacteria. So next time, and if you feel toothache, very serious pain, you can use some analgesics, but at the same time, you should use the drugs inhibit or kill anaerobic bacteria in oral cavity, such as metronidazole, and also can kill amoebiasis, one kind of intestinal infection. And this one, Giardia and trichomoniasis. Do you know this? This always infect female patients. Female patients. Vaginitis, vaginitis patients, female vaginitis, and vaginal itching. These female patients, and they have vaginitis because they infect this. Most patients they infect this. Giardia sisand. So we should use metronidazole to kill this one, to treat vaginitis, vaginal itching. And the other section of metronidazole, lots of other section, such as the patients the bitter taste, and in fact this drug have serious other section, induce cancer, induce abnormal. So next time, if you want to use metronidazole to treat your toothache or some other anaerobic bacterial infection or vaginitis and so on, so I should suggest you don't use metronidazole. You should use T-nidazole. Do you know T-nidazole? Chinese name. So because this drug are widely used in China, so in fact, I think you will use this drug in your country, in China. So next time, if you use this one, the Chinese name, this one is 甲硝唑. Do you know? This drug is the 甲硝唑. So next time, if you in China, you have a toothache, you want to use some drugs, you can use this 甲硝唑. But I should suggest you don't use 甲硝唑, and you should use this one. The name is T-nidazole, T-硝唑. The Chinese name is T-硝唑. Do you know what's the meaning T? Replacement. So we use T-硝唑 because I teach you pharmacology. Lots of students always ask me, "Oh, teacher, I have a toothache, or some young ladies they have some infections." They always ask me. So next time you use the drug is this one, T-nidazole, T-硝唑. Okay. So we finished the last antibiotics. And in antibiotics, we studied penicillin, cephalosporins, erythromycins, and we also studied tetracyclines, aminoglycosides. This class, we studied artificial synthetic drugs such as quinolones, and we also studied the sulforamides, and the last drug is Mitronidazole. Next class, we will study how to treat tuberculosis and antifungal, antiviral agents. Okay, so class is over. See you next time.